As rightly said by Charles Darwin, it is not the strongest of the species that survives, nor the most intelligent, but the one most responsive to change, which is the essence of Siemens Innovation Think Tank. Good morning, everyone. We are team number 4 who are working on preparing the disease care plan for peripheral vascular disease. Myself, Dr. Adil Khan, I am a physician, but my knack for technology and innovation has pushed me to pursue my career in medical technologies. I am currently a Stanford India Biodesign Fellow in AIMS, IIT Delhi, and Stanford University. My other team members are Adham, Noor, and Sheikh, who are final year biomedical engineering students in Ajman University. We are going to walk through our work done in past 1 week in Innovation Think Tank certification program in coming few slides. We were given a topic of PVD, so first we started by brushing off my understanding of the PVD by reading Bailey and Love's surgery book and Harrison Internal Medicine in detail. Then we went through more than 50 research papers to understand the present scenario and PVD's impact globally and in UAE. After basic understanding, we talked to more than 20 PVD patients in India and UAE to get their pain points and then later discuss these pain points with stakeholders like doctors, endovascular surgeons, entrepreneurs working in this field from US, India, and UAE. Through this care plan, we highlight data from collection of around 50 pain points and more than 40 solutions which are connected to around 15 stakeholders. To our amazement, PAD is affecting more than 200 million people worldwide and 15% of the population above 65 age groups in UAE. Above all, PAD is number one leading cause of amputation, and it is since it's one of the underrated disease, but it affects 6 times more people than HIV. To make you understand better about the disease pathway, we decided to walk you through the journey of hypothetical person Mr. Samir, who is 70-year-old male who is overweight for his height and he is suffering through diabetes and hypertension, and at the same time he has been smoking for his entire life. That means he is having all the risk factors for PVD to develop. Prevention is better than cure. Can't be more emphasized in any disease than PAD. So these are the pain points at this stage. If they can be addressed at this stage, then we can stop the development of the disease. Problems like lack of awareness about healthy lifestyle and symptoms and interdependencies can be solved by an app which can educate, send diet recommendation and exercise reminders. We can also develop smart AI applications with questionnaires of how the patient feels today, and doctor appointments can be booked if required, which will solve the problem of no regular checkup with geriatrician at old age. Coming back to the story, Samir has started noticing strange symptoms in his left leg and he ignored of the symptoms for months, and one day he had to be rushed to the ER after painful cramp which was later diagnosed to be late stage PAD, that is peripheral arterial disease. These are a few of the main pain points in the symptoms and diagnosis stage of disease journey. If solution for which had been out there in the market, then Samir's PAD could have been diagnosed in early stages and could have been treated with simple medicines and lifestyle changes. Since its late stage PAD, interventional procedure is required which adds to the anxiety. Lumivascular atherectomy was done which reduces radiation exposure of the patient and doctor. Since Samir didn't follow the assigned care plan and his condition was reversed to the extent of requiring an amputation. The doctor also recommended the new online emotional support program since he knew of the post-surgical emotional trauma. These are few of the pain points and their successive solutions below them during treatment and rehabilitation stage. Some of these solutions are already in practice, and if others can also be implemented in normal practice, then we might have saved Samir from amputation. Samir was devastated with this new change, and thus he was recommended an affordable 3D printed prosthetic limb. Among all this, COVID-19 outbreak happened. Samir could no longer go to hospital due to an increased risk of infection, so someone recommended him an app where he can opt for virtual visits to his doctor. Due to COVID-19 restrictions, since he couldn't abide by the long-term care program, the doctor on that app noticed his deteriorating health through remote monitoring device and recommended VR rehabilitation program. Thus, Samir now leads a healthy life after he was introduced to that new, innovative, groundbreaking app. These are few of the major problems in the follow-up stage which can be solved by one single solution integrating remote monitoring, telemedicine and predictive algorithm to improve the outcome. COVID 19 has impacted each of our lives. At the same time, it has affected PVD patients' life as well in the following ways, as you can see, many of which can be solved using simple digital health technologies. We selected the 5 main pain points after doing relevant market research, lack of existing solutions, and clinical impact of solutions to these problems. Symptoms of PVD are not obvious. We can solve this problem with a fatigue measuring device which collects gait information and analyzes the data with getting tired and activity levels during the day to calculate objective fatigue level and helps patient to predict the disease using machine learning algorithms. Ankle brachial pressure index is commonly used in low cost setting to diagnose the disease, but it has its own shortcomings. It can be replaced by photoplethysmography. Virtual rehabilitation enables patients to take charge of their own rehabilitation plan and to progress their own pace without requiring the medical personnel. Increasing level of ionizing radiation exposure to patients and doctors poses a great problem. But radiation-free technology, Lumivascular, allows you to perform an atherectomy procedure with potentially limiting the amount of radiation exposure. A special footwear with specific characteristics reduce the load on calf muscles. This resulted in an increase of pain-free walking distance by 39%. You can read more about them in detail in subsequent slides. Summarizing it all, as I told you, prevention is better than cure in PVD. Thus, if we start to adopt value-based care instead of service-based care, we can save a lot of money of government, insurance companies, and patients themselves. Value-based care integrating remote monitoring, telemedicine, artificial intelligence, and machine learning can improve the outcome of patients. Thank you.